Let's now take a look at some dental considerations and prevention strategies. Obtain a thorough medical history before dental treatment. This will help identify patients that are at more risk of hypoglycemic event. Being aware of the signs and symptoms of hypoglycemia will enable a faster response and management of the emergency before it becomes life-threatening. Patients with hypoglycemia can behave similar to people who are intoxicated or impacted by drug use, showing irrational or aggressive unreasonable behavior, so keep an open mind. Ask the patient if they have eaten in the last 4 or 5 hours. If unsure, it is advisable to administer glucose to see if there is an improvement in the patient's condition. Keep in your dental clinic's emergency kit a blood glucose monitor and a source of glucose, such as glucose gel or powder, or other rapid-acting glucose-containing food sources like jelly beans. Know the rule of 15. For an adult showing signs or symptoms of hypoglycemia, administer 15 grams of glucose every 15 minutes until blood glucose or symptoms improve. If 3 or more doses are required, seek medical advice.
Advise patients with diabetes to bring their blood glucose monitor and measure their blood glucose before starting dental treatment. Random blood glucose concentration can range from 4 to 12 millimoles per liter. If the patient's blood glucose is lower than 4 millimoles per liter, or if the patient is displaying signs or symptoms of hypoglycemia, then treat the patient as if they are hypoglycemic and administer the appropriate amount of glucose. Remind patients to take their medications and eat their meals as normal so there's minimal disruption to their normal schedule. Schedule dental appointments from mid-morning to early afternoon so the patient is less likely to skip meals and any issues that arise will have time to be addressed. If possible, consider splitting long appointments into shorter ones. The patient will experience less disruption to their normal eating schedule, decreasing the risk of hypoglycemia.
Hypoglycemia can also happen because of dental treatment. If a patient experiences oral pain, then they may be more likely to skip meals and be at risk of experiencing a hypoglycemic event. To avoid this, ensure the patient has adequate pain control and advise them to continue to eat regularly and take their usual medications.
Let's quickly review the dental considerations and strategies to prevent a hypoglycemic incident. The dental considerations are: obtain a thorough medical history, recognize signs and symptoms of hypoglycemia and know how to manage it, keep glucose and a blood glucose monitor in the dental clinic, and know the rule of 15. Strategies to prevent a hypoglycemic incident includes: 1. Test the blood glucose level of diabetic patients before commencing treatment. 2. Advise patients to take medications and eat meals as normal. 3. Time appointments to avoid skipping meals. 4. Avoid long appointments. And 5. Ensure good pain control. This concludes our presentation. Thanks for watching.